and part of the reason I released it was one, everybody was talking about it. So Michael Phelps is an American swimmer. 2016, he's from Baltimore, where I practice, and he had the perfectly circular cupping marks all over his body. And it was funny to me because watching the Olympics 4 years before that, I was looking at the swimmers from Korea and China, and they all had the cupping marks. And I know on that pool deck, every swimmer was like, "What is that on those people? And should I be doing it?" Right. And then, of course, those athletic trainers, those therapists, all those people that were poolside were like, "Oh, I better go learn that." Why? Because the athletes are asking for it. But cupping is it's often assumed that it's Chinese in origin. But truth be told, it's much older. It's about at least 5,000 years old. We know that in Egypt, the Ebers Papyrus, which was discovered, I think, in the 90s or something, but it dates to 1515 BC, talks about cupping. It talks about surgery. It's a medical text in ancient Egypt, and it's actually really advanced. Some of those surgical techniques are almost, if you read it alongside of a Western surgical manual, they look pretty similar. There might be different materials, but the technique is almost the same, which is kind of amazing that thousands of years ago they knew this. But cupping itself involves adhering, creating a vacuum in a jar, or classically it was buffalo horn or clay pots or sections of bamboo. Uh, you would have to use fire then to eat the oxygen and create this vacuum. Then you then stick it to the surface of the skin. What happens is you pull the skin up into the cup. And as you're doing that, it separates the skin from the fascia and the fascia from the muscle, creating a void in that tissue that's deeper, and it pulls blood up to the surface. So you're creating this little like local increase of circulation, which is a little bit of inflammation, but it's pulling the blood that hasn't been circulating, maybe because the tissue is already inflamed, into a void where the body can slowly kind of clean that up. But fresh blood is coming in behind it, right? Once again, fresh blood has nutrients, oxygen, the things the tissue needs to repair itself. Um, it is absolutely great for pain. It is great, and I think in these swimmers' cases where they're all marked up, the athletes, they might be using it for quick lactic acid removal, right?